Did you know the position you sleep in tonight could either protect your heart or silently form blood clots that push you closer to a stroke? Most people assume that sleep is a time when the body fully relaxes and recovers, but from a cardiovascular perspective, it can actually become one of the most vulnerable periods of the day, especially as we age. During sleep, the body shifts into a state where movement is minimal, circulation slows, and gravity begins to influence how blood pools in different parts of the body. In younger individuals, the vascular system compensates efficiently, but in adults over 60, blood vessels lose elasticity, and the mechanisms that keep blood flowing smoothly are not as effective. This creates an environment where blood can move more slowly, particularly in the lower extremities, increasing the likelihood of clot formation. A critical factor here is reduced production of nitric oxide, a compound that helps blood vessels stay relaxed and allows blood to flow freely. As nitric oxide levels decline with age, vessels become narrower and less responsive, which increases resistance within the circulatory system. When blood flow becomes sluggish under these conditions, it creates the perfect scenario for clotting, especially during long, uninterrupted periods like sleep. Unlike during the day, when walking and movement help push blood back toward the heart, the body at night relies heavily on passive circulation, which is significantly influenced by posture. What makes this even more concerning is the timing of cardiovascular events. Research has shown that a large proportion of strokes occur during sleep or within the first hour of waking. This is not a coincidence, but rather a result of multiple physiological processes happening simultaneously. Blood pressure, which normally dips during sleep, may not drop adequately in some individuals, a condition known as non-dipping. At the same time, blood viscosity can increase, and the body's natural anticoagulant processes may be less active. When you combine slower circulation, increased blood thickness, and reduced vessel flexibility, the risk of clot formation rises significantly. Additionally, fluid redistribution plays a major role. Throughout the day, gravity causes fluid to accumulate in the legs and feet. When a person lies down at night, this fluid shifts back toward the upper body, increasing the volume of blood the heart must handle. For some individuals, this sudden shift can temporarily increase pressure within the cardiovascular system, further stressing the heart and blood vessels. If circulation is already compromised, this added burden can contribute to instability in blood flow, making clot formation more likely. Another overlooked aspect is the lack of awareness during sleep. While awake, the body can respond to discomfort or adjust position to relieve pressure, but during sleep, these protective responses are limited. This means that if blood flow is being restricted or slowed due to an unfavorable position, it can continue for hours without interruption. Over time, repeated nights of suboptimal circulation can contribute to cumulative damage, even if there are no immediate symptoms. Symptoms such as waking up with swollen ankles, heaviness in the legs, or feeling unusually fatigued in the morning are often dismissed as normal signs of aging, but they can indicate that circulation during sleep is not functioning optimally. These signs suggest that blood and fluid are not being efficiently returned to the heart, reinforcing the idea that what happens during sleep has a direct impact on cardiovascular health. Many people believe that as long as they are getting enough hours of sleep, the exact position they sleep in does not matter. But from a cardiovascular standpoint, certain positions can create mechanical stress on the heart and blood vessels that accumulates over time. The body's anatomy is not symmetrical in function, and the way organs are positioned inside the chest means that posture during sleep can directly influence how efficiently the heart pumps blood and how smoothly that blood circulates throughout the body. When someone consistently sleeps in a position that disrupts this natural flow, it can lead to subtle but persistent strain on the cardiovascular system. Sleeping on the stomach is one of the most problematic positions because it compresses the chest cavity against the mattress. This external pressure limits how freely the heart can expand and contract with each beat, effectively reducing cardiac efficiency. At the same time, the diaphragm's movement becomes restricted, which can interfere with normal breathing patterns and oxygen exchange. To breathe in this position, the head must be turned to one side, which can compress blood vessels in the neck and potentially reduce blood flow to the brain over extended periods. Maintaining this posture for several hours each night creates repeated mechanical stress that the body has to compensate for, increasing the workload on the heart. Flat back sleeping may appear neutral, but it introduces its own set of risks, particularly in older adults. In this position, the tongue and soft tissues of the throat are more likely to collapse backward, partially obstructing the airway. This can lead to episodes of interrupted breathing, even in people who have not been formally diagnosed with sleep apnea. Each interruption in breathing causes a drop in blood oxygen levels, followed by a sudden spike in blood pressure as the body attempts to restore normal breathing. These repeated fluctuations place significant stress on blood vessels and can damage their inner lining over time, contributing to hypertension and increasing the risk of cardiovascular events. Right-side sleeping, which many people naturally prefer, also has less obvious but important drawbacks. The heart is positioned slightly toward the left side of the chest, and the aorta, the main artery carrying blood away from the heart, curves in a way that aligns more naturally with left side positioning. When lying on the right side, this alignment is less optimal, and the heart may have to work slightly harder to maintain efficient blood flow. Additionally, the liver, which is located on the right side of the body, can exert upward pressure when lying in this position, subtly affecting how the heart fills with blood between beats. While these effects may seem minor on a single night, repeated exposure over years can contribute to increased cardiovascular strain. Another important factor is the lymphatic system, which plays a key role in clearing waste and inflammatory substances from the body. This system relies heavily on gravity and body positioning to function efficiently. Certain sleep positions can hinder this natural drainage process, leading to a buildup of inflammatory markers that can contribute to vascular damage and plaque formation. Over time, chronic inflammation becomes a significant driver of cardiovascular disease, linking poor sleep positioning to long-term health outcomes. What makes these positions particularly concerning is that they do not produce immediate noticeable symptoms. The body adapts and compensates in the short term, which can create a false sense of safety. However, the cumulative effect of nightly mechanical stress, disrupted breathing, and inefficient circulation can gradually increase the risk of serious conditions such as hypertension, blood clots, and stroke. Because these changes occur slowly and silently, many individuals remain unaware that their habitual sleep position may be contributing to underlying cardiovascular strain until a more serious event brings attention to it. The human cardiovascular system is not arranged randomly, and the positioning of the heart, major blood vessels, and surrounding organs creates a natural directional flow that can either be supported or resisted depending on how the body is positioned during sleep. Sleeping on the left side aligns more closely with this natural anatomy, allowing gravity to assist rather than hinder the movement of blood through the heart and into the major arteries. Because the heart sits slightly left of center and the aorta curves toward the left before descending through the body, this position reduces unnecessary resistance and allows blood to move in a smoother, more efficient pathway. When the body is positioned on the left side, venous return, which is the flow of blood back to the heart, becomes more efficient. Blood returning from the lower parts of the body does not have to work as hard against gravity or structural compression, which reduces the workload placed on the heart during each beat. Over the course of an entire night, this seemingly small improvement in efficiency can translate into a meaningful reduction in cardiac strain. The heart is able to pump more effectively with less effort, which is especially important for older adults whose cardiovascular systems are already operating with reduced elasticity and responsiveness. Another key advantage of left-side sleeping is its effect on the lymphatic system, particularly the thoracic duct, which is the main channel responsible for draining lymphatic fluid and waste products from much of the body. This duct empties into the venous system on the left side, meaning that sleeping on the left can facilitate more efficient drainage of metabolic waste and inflammatory substances. Improved lymphatic flow reduces the accumulation of toxins and inflammatory markers that can contribute to damage within blood vessels. Since chronic inflammation plays a major role in the development of atherosclerosis and other cardiovascular conditions, enhancing this natural clearance mechanism can have protective long-term effects. Left-side positioning also has a stabilizing influence on the autonomic nervous system, particularly through its interaction with the vagus nerve. This nerve plays a crucial role in regulating heart rate, blood pressure, and digestive function. When the body is in a position that reduces internal pressure and promotes efficient circulation, the parasympathetic branch of the nervous system is more active, leading to a calmer, more stable cardiovascular state. This can result in a lower resting heart rate during sleep and more consistent blood pressure patterns, both of which are associated with reduced cardiovascular risk. In addition to these internal mechanisms, left-side sleeping can also reduce the likelihood of acid reflux, which indirectly benefits heart health. When stomach acid flows back into the esophagus, it can stimulate the vagus nerve in ways that may trigger irregular heart rhythms in sensitive individuals. By keeping the stomach positioned below the esophagus, left-side sleeping minimizes this reflux, thereby reducing potential disturbances in cardiac rhythm and improving overall sleep quality. The cumulative effect of these benefits is not dramatic in a single night, but over weeks, months, and years, the impact becomes significant. Improved circulation, reduced cardiac workload, better lymphatic drainage, and more stable nervous system activity all contribute to a lower risk environment for the development of blood clots, arterial plaque, and cardiovascular events. Because sleep occupies a substantial portion of daily life, even small improvements in how the body functions during these hours can have a disproportionate effect on long-term health outcomes, particularly in populations already at elevated risk due to age or pre-existing conditions. Adding upper body elevation during sleep introduces a mechanical advantage that significantly alters how the cardiovascular system functions over several uninterrupted hours. When the upper body is elevated at an angle of approximately 15 to 20 degrees, gravity begins to assist in redistributing blood and fluid more efficiently, reducing the workload placed on the heart. Instead of the heart having to push blood upward toward the brain against a completely flat plane, the slight incline creates a more favorable pressure gradient, allowing blood to circulate with less resistance. This subtle shift can have a measurable impact on how hard the heart has to work throughout the night. One of the most important effects of elevation is its influence on nighttime blood pressure patterns. In a healthy system, blood pressure naturally drops during sleep in a process known as nocturnal dipping. This reduction, typically around 10 to 20%, allows the cardiovascular system to rest and recover from the demands of the day. However, in many older adults, this dipping response is diminished or absent, a condition referred to as non-dipping. When blood pressure remains elevated throughout the night, the blood vessels are exposed to continuous stress, which accelerates wear on their inner lining and increases the likelihood of events such as stroke or heart attack. Elevating the upper body has been shown to help restore a more normal dipping pattern by reducing central blood volume and easing the pressure within the vascular system. Elevation also plays a role in reducing venous congestion, particularly in the upper body. When lying completely flat, blood returning from the lower body can accumulate more readily in the chest and neck regions, temporarily increasing pressure in these areas. This can contribute to discomfort, disrupted sleep, and in some cases, increased strain on the heart. By slightly raising the upper body, this pooling effect is minimized, allowing for a more balanced distribution of blood volume. As a result, the heart does not have to compensate for sudden shifts in pressure, leading to a more stable and efficient circulatory pattern. Breathing mechanics are another area that benefits from elevation. A slightly inclined position helps keep the airway more open, reducing the likelihood of partial obstruction that can occur when lying flat. Improved airflow leads to more consistent oxygen levels in the blood, preventing the repeated drops in oxygen saturation that can trigger spikes in blood pressure and heart rate. Over time, maintaining stable oxygen levels during sleep helps protect the integrity of blood vessels and reduces stress on the cardiovascular system. This is particularly relevant for individuals who may experience mild, undiagnosed breathing disturbances at night. Fluid dynamics within the body are also positively affected by elevation. During the day, fluid tends to accumulate in the legs due to gravity, and when a person lies flat at night, this fluid shifts back toward the upper body. If this shift happens too rapidly or in large volume, it can place additional strain on the heart and kidneys. Elevating the upper body moderates this redistribution, allowing fluid to move more gradually and reducing the burden on these organs. This can lead to fewer nighttime awakenings related to the need to urinate and a more restful, uninterrupted sleep cycle. Over time, the combined effects of improved pressure regulation, reduced vascular strain, better oxygenation, and more balanced fluid distribution create a more favorable environment for cardiovascular health. While the adjustment may seem minor, maintaining this position consistently can contribute to better long-term outcomes by supporting the body's natural rhythms and reducing the cumulative stress that builds when the cardiovascular system is forced to operate under less optimal conditions night after night. A simple nighttime routine can significantly influence how efficiently the cardiovascular system functions during sleep, particularly by addressing one of the most overlooked factors, fluid and blood pooling in the lower body. Throughout the day, gravity causes blood and interstitial fluid to accumulate in the legs and feet, especially in older adults where vein elasticity and valve efficiency are reduced. By the time a person goes to bed, the lower extremities often carry excess fluid that the body must redistribute once lying down. If this redistribution happens abruptly during sleep, it can increase the workload on the heart and disrupt stable circulation patterns. Elevating the legs for about 15 minutes before sleep directly targets this issue by allowing gravity to assist in returning pooled blood and fluid back toward the heart in a controlled manner. When the legs are raised above heart level, venous return improves without requiring additional effort from the cardiovascular system. This preemptive adjustment reduces the volume of fluid that would otherwise shift suddenly during the night, creating a smoother transition into the sleeping state. As a result, the heart is not forced to handle a rapid increase in circulating volume while the body is in a passive, resting condition. Another important component of this routine is maintaining proper body alignment during sleep. Placing a pillow between the knees while lying on the side helps keep the hips, pelvis, and spine in a neutral position. Without this support, the top leg tends to fall forward, which can twist the pelvis and create compression in the blood vessels passing through the groin and upper thigh. Even mild compression sustained over several hours can reduce blood flow efficiency, contributing to slower circulation and increasing the likelihood of clot formation. By keeping the lower body aligned, this simple adjustment ensures that blood vessels remain open and unobstructed throughout the night. Supporting the upper body with a stable incline and ensuring the head and neck remain in a neutral position further enhances the effectiveness of the routine. When the spine is properly aligned from head to tailbone, there is minimal mechanical interference with both blood flow and nerve signaling. This alignment allows the cardiovascular and nervous systems to operate without unnecessary strain, promoting more consistent heart rate patterns and stable blood pressure during sleep. It also reduces the likelihood of discomfort that might cause frequent position changes, which can interrupt the continuity of rest. Consistency is a critical factor in the success of this routine. The benefits are not derived from a single night of correct positioning, but from repeated, uninterrupted support over time. Each night that the body experiences improved circulation and reduced vascular stress contributes incrementally to better overall cardiovascular health. Over weeks and months, these small improvements can accumulate into noticeable changes, such as reduced morning swelling, fewer nighttime awakenings, and improved energy levels upon waking. An additional advantage of performing leg elevation before bed is its effect on nighttime urination patterns. When excess fluid is redistributed earlier in the evening, the kidneys have time to process and eliminate it before sleep begins. This reduces the likelihood of waking up multiple times during the night to use the bathroom, which not only improves sleep quality but also prevents repeated interruptions that can affect cardiovascular stability. Continuous, undisturbed sleep allows the body to maintain more consistent physiological rhythms, including heart rate and blood pressure regulation. By combining leg elevation, proper alignment, and supportive positioning, this routine creates an environment where the cardiovascular system can function with minimal resistance and maximal efficiency. Rather than forcing the body to compensate for poor circulation during sleep, it prepares the system in advance, allowing natural processes to operate under more favorable conditions. Over time, this reduces cumulative strain on the heart and blood vessels, lowering the overall risk of complications associated with poor circulation and vascular stress.